Hello everyone, my name is Giorgia. I'm a fourth-year medical student from Italy, from the University of Milano Bicocca. I've been here for an observership program for 3 months. My first month was in gynecology with Aisha Madam, the second month in pediatrics with Anju Madam, and the third month in the emergency department with Ashish Sir. The first month in gynecology, I really enjoyed it because I got to see everything that Aisha Madam does on a daily basis. So I got to do the outpatient departments, so seeing the routine visit for pregnancy women, also for any kind of visits like for infection diseases, for prolapse, for uterine hyperplasia, so a lot of different conditions, and also the routine with the pregnancy, so the ultrasound machine and all the kind of exams that you do during the 9 months of pregnancy. So I got to see how the approach changes from Italy to India. So some exams, some routine exams are different, some approaches are different. Here I think in India there is a more direct approach, so you directly go to the conclusion, to the fact. Otherwise, in Italy, it's more like of a complex way that sometimes it needed to be like that, but sometimes it's actually easier and more effective to do it directly. Other than the outpatient department, I got to see the labor room, so the approach to the pregnant woman that it's going to deliver. So I got to see natural deliveries, and also emergency C-sections. Here also there is a massive change from what I saw in Italy and what I saw here, because here the gynecology doctor is more present during labor. In Italy, the gynecology arrive just for the delivery, but here there is a more controlled approach also during the last hours before the delivery. Other than the OPD and the labor room, I've also seen the operating theater. So I got to see many different surgeries. I've got to see hysterectomies. I've got to see C-sections. I've got to see uterine and salpingectomy, and also I've got to scrub in some surgery, so seeing directly into the field and feeling like I was actually doing something, even if it was a small thing. I think in surgeries is the place that is more similar to Italy. So I think that in the operating theater it's very similar, other than in the OPD, in which I saw a lot of differences. Then my last month was in the emergency department. So in emergency department, it was really different from the other departments, because you are not with just one doctor and you see what he or she does, but you can see all the department, because you have a short stay unit, so a room where there are a patient that needs observation for some hours or 1 or 2 days, and are just there to be observed before leaving the hospital. And then you have a room for yellow coats, so patients that need more assistance but are not a real emergency. So there you can follow all the different cases. You can ask the different doctor for what condition the patient has, and what are the treatments that they can do in the emergency department, and what are the treatments that they can't do there, and they have to ask for a consultant of a different department. And then you have the red coat room. The red coat room is for the more emergent cases. So you have some trauma there, you have heart attack, you have at heart failure, in respiratory insufficiency. So you have all that kind of emergency that need a fast approach, and that was very an inspirational thing to see how all the different doctors and nurses work, and they are always in control of the situation, even if the situation is an emergency, and even if maybe it can seem that it is maybe a chaos, but like it's in order. Like they can know what they do, and everyone has a special role, and everyone follow what they need to do. So it was very inspirational to see what they can do. And also, I saw different cases from what I see in Italy, because here there are some conditions that we can see in the emergency department in Italy, such as rabies shots. We usually don't give them in Italy, but here there is some cases. Also, snakes bites. I felt that what I study in theory and that I cannot see in hospitals in Italy, here I could saw. So it was really inspiring for me. So thank you so much for the opportunity. I felt that I learned so much in these 3 months, both clinically and as a human beings, and as the approach to the patients, not just of the condition. So thank you so much, PRS Hospital, and thanks to all the doctors, the nurses, and the staff that follow me through this course. So thank you.